This lecture involves the concept of safety, which includes handoff communication and SBAR. Let's get started. The Joint Commission of National Patient Safety Goal 2E is to implement a standardized approach to handoff communications, including an opportunity to ask and respond to questions. They suggest that we use a standardized way of communication or to inform others when we are discussing the care of our patients. We should include the date of information regarding care, treatment, services, condition, and recent or anticipated changes. Ensure you have limited interruptions and sufficient time allocated. Process for verification of the information. Repeat back or read back. An example of this is a licensed nurse sometimes needs to take orders from a healthcare provider or receive lab results over a telephone. If that happens, it first has to be a licensed RN, but second, or could be a licensed LPN. But second, you also need to make sure that you repeat back all orders, or in the case of the lab calling you, all results to the individual providing the information before you hang up, and you must receive verification that it is correct. There are many times where things have been miscommunicated or not heard clearly or clearly understood when important information such as new orders or lab results are given over the telephone. You will not have opportunity to take orders in this way as a student, but I want you to please remember you always, always, always have to repeat or read back the orders or lab results when you're taking them over the phone, or if someone is giving you the information in person as a verbal order. The receiver reviews relevant historical patient data, including previous care, previous treatment, and previous services. Handoff is defined as the transfer of information along with authority and responsibility during transitions in care across the continuum for the purpose of ensuring the continuity and safety of the patient's care. That is what this standardized formats of transfer of information is all about, and that is promoting patient outcomes and promoting their safety. Transition of care may be a transfer from one facility to another. For example, a patient being discharged from a hospital and now being transferred to a rehab facility. Another example is a patient transferring units within a healthcare facility, such as the operating room, and now are being transferred back to a patient floor. Types of handoffs include on-call responsibilities, critical reports, as I mentioned, including laboratory and imaging study results, hospital transfers, either to the home or skilled nursing facility, such as or a rehab facility that I mentioned, and other transitions in care, for example, from the ED or radiology or to physical therapy or coming back from physical therapy. Also includes patient handoffs, level of care, cross coverage, nursing shift change or break relief, or a physician transferring care from an operating room to a post-anesthesia care unit or PACU. It's important because we always want to have patient safety as a top priority and promote consistency. Don't know why that keeps doing that. Barriers include human error, limitations of learning and training, continuity gaps, negative impact of fatigue. A nurse may be exhausted and forget information, time constraints, or volume of information. Standardized communication focuses on the patient and not the people. Standardized format allows all parties to have common expectations, such as what is going to be communicated, how the communication is structured, required and or important elements that should be transferred or communicated. Assertive communication means one is organized in thought and communication. One is competent technically and socially, letting go of perfection while concentrating on clarification and common understanding, and it must be valued by the receiver to be successful. Assertion is not aggressive or hostile. It is not confrontational or ambiguous. It is not ridiculing or rude, and certainly not unprofessional. Good communication gets the person's attention. Make eye contact. Be face-to-face with the person. I will let you know, though, when we get to Module 6, there are certain cultures who feel that direct eye contact could be disrespectful. So we do need to be aware of cultural norms. However, in our culture, making direct eye contact is important. Use the person's name, not only their name, but ask them how they want to be addressed. Express concern. Use the communication techniques such as SBAR, and we'll talk about that shortly. Reassert as necessary. Decisions should be reached and escalate if necessary. SBAR is a form of communication that we utilize in different situations, particularly when we have a change of status in our patient. S stands for situation. What is the current issue? B stands for background. Be brief and relate it to the point or the situation. A is assessment, what you find or think. And R is recommendation or request. What do you want next for your patient from a provider typically? Let's look at situation. This would include the patient's age, gender, for example, a pre-op diagnosis or procedure that's going to take place, mental status, and is the patient stable or unstable? What is actually happening to the patient right now? B is any pertinent medical history, such as allergies as well, sensory impairment, family location, religion, culture, interpreter required, valuables, deposition, maybe previous surgeries included in that past medical history as well. A is for assessment, vitals, isolation required, a head-to-toe assessment, including a focused assessment with abnormal findings, risk factors, issues that you're concerned about, or recent changes that's taken place with the patient's assessment. And last are recommendation or request, specific care required immediately or soon. Some priority areas may include pain control, an IV pump or IV solution if you're concerned about dehydration, family communication needed by the provider with the family, or maybe you need a medication discontinued, or maybe you're concerned about infection and want a culture done to rule out an infection, such as a urinary tract infection. And that concludes this lecture, with the exception of a video for you to watch, and I'll leave you with that, on SBAR. There's also an SBAR video in your ATI that I highly recommend you view.